Hi, my name is Dutrochet Djoko. I go by Dean Djoko, and welcome to Pharmacy Talks with D. Today we're going to continue our conversation about the opioid crisis that is ravaging our country. Last time we did establish that this was a problem, that this was a big problem. And we all agree and see how it is devastating communities all over the United States. So today, we're going to focus on part of that problem and start talking about some solutions. My focus today will be on prescription drugs. As we established last time, it is where most people start. A lot of people who end up using heroin and other hard drugs start by prescription drugs. The first thing is going to be to determine what is it, what kind of prescription drugs are we talking about? Because there are different types of prescription drugs, but we're referring here to stimulants, things like Adderall, Concerta, Vyvanse, or opioids like oxycodone, oxycontin, or anxiolytics like benzodiazepine. These are prescriptions that have the potential of causing dependency, especially if you use them the wrong way. So that's what we'll be focusing about, because as a pharmacist, it is important that when we dispense medication, we don't feel like we are feeding somebody's addiction. And also, there's this myth out there where people think by abusing prescription drugs, it is better. It's safer to abuse prescription drugs compared to street drugs. Well, I'm here to tell you it is as dangerous and can also be lethal if you do abuse prescription drugs. So where do people get these drugs from? And I'll focus here on our youth, for example. Because in order for you to get those medication the right way, you need to get a prescription from your doctor, you need to go to the pharmacy, and the pharmacist is going to dispense the medication. But we've noticed that almost 60% of youth who abuse these medications get them for the first time from a friend or a relative. Almost 6 out of 10 kids who abuse prescription drugs get them for the first time from a friend or a relative. That is huge. And what is it that we need to do about it? Education. Educate people. Talk to them about the importance of keeping those medications safe. Educate the youth and talk to them about the importance of not sharing their prescriptions with friends or relatives. Why are the youth so prone to getting addicted? It is because, the brain of a young person is not fully developed. And when these substances are used at a very young age, it has the potential of changing the chemistry inside the brain, therefore putting them at more risk to prescription abuse. I'll put it in like 3 buckets. If you look at table number 2 here, I will put the risk factors of prescription abuse in youth in 3 different buckets. The first one is going to be biological. In the biological aspect of it, I refer to things like genetic. So the genetic has something to do with it. Some of us, for some reasons, are a little more predisposed to having issues with, addictions. The second part is going to be the psychological aspect of it, or I usually say trauma, PTSD, and other traumatic events. The third bucket is the social aspect, the family circumstance, the peers, the schools, the community. And that is the aspect where we can have the most impact. Because we can't do anything about our genetic. Our genetic is our genetic. We can't do anything about it. We can't change it. But studies have shown that when a youth does not use prescription drug or does not abuse substances or does not use prescription drugs in an abusive way before the age of 25, for example, the genetic aspect of it does not matter. So how early the kid uses or abuses prescription drugs can have a big impact into the potential of them being an addict or abusing other medications in the future. The trauma. We also have very little wiggle room. We have some, but sometimes it's out of our control because you don't always know when a traumatic event will occur. The third bucket is the one where I would like us to focus on the most. Is the peer pressure, is the family situation, is the community. What are some of the things that we can do in the community to help the kids stay safe and stay away from prescription drug abuse? That is the bucket where we can have the most impact. Very, very basic things that we could do. We are fortunate to live in a town like Denver. Before I go to some of those things that we could do, where we have organizations like Denver Cares, who spends a lot of time, a lot of resources, and have a lot of youth involved to work and help other youth stay healthy and safe. But as a parent, it's important that all of us, adults in town, in our own home, start to take some very basic steps to help in this situation. For example, how many of us have medicine cabinet at home? How secure are those? Can a child just walk in your medicine cabinet and grab the remainder of the oxycodone you had after your last surgery or your last root canal? How secure do we keep these medications in our own house? We are fortunate also in Denver where you can take those unused medications down to the Denver police station, and there's a drop box right in front there where you can put those and they'll dispose of it the right way. Please do not leave those at home, because we may pay, I don't know, maybe $2-5 copay and think, well, let me keep the rest of this because I might need it next year or in 2 years or in 3 years. I'm not sure. Is that really worth the life of your child? I don't think so. So getting rid of unused medications is one of the basic steps that we can take to make sure that these are out of our houses. Number 2, having a conversation with your kids. And you ask me, when should I start? And how do I have that conversation? I wish there was a guide or a book where I can say, this is what you need to start, this is what you need to say. There's no right way to say it. There's no one way to say it. Because as we discussed earlier, the reasons why people develop this condition varies. There are many, many reasons. So each person will be unique. And that's why there's no one way to start up the conversation. But we have to start that conversation. We have to talk to our kids and our youth about this issue. We can start with a kid as young as 4 years old, for example. If you have a child taking multivitamins, the gummy bears, and they take that first tablet, they chew it daily. They're taking just the daily multivitamins. And then one afternoon, they come to you and they say, Mommy or Daddy or Auntie or Grandma, could I get that extra gummy bear? That could be an opportunity to start up a conversation. That could be an opportunity to make the child understand that this is supposed to only be taken once a day. And if you take too much of it, it could be a problem. Just like we teach our kids to brush their teeth before when they wake up in the morning or before they go to bed, same thing. We are setting the foundation of proper use of medication. It is not candy. This is medicine, and you have to take it properly at a specific dose. We can't wait these days until our kids get to high school or to college before we start this conversation. We definitely have to make sure that we start it much sooner than that because of the nature of the crisis. Let's be honest with our kids. If you have a family history, or if you think that because of your family history, your child is more prone to developing this condition, be honest. Talk about that uncle or that aunt who had a problem with alcoholism, or that grandpa or grandma. Or it is important, because what happens is if we don't talk to our kids about it, they might go to a party and maybe just start drinking, for example. Now, I'm not talking about prescription drug now, but just start drinking without knowing that they are more predisposed than the other kids. So having that conversation early and often will bring it to the forefront and help our kids and educate them to make those wise and healthy decisions. What are some of the things to look out for? Because another question that I always get is also, how do I know if my kid is using? How do I know if my kid is abusing? I think they're fine, but I'm not sure. Well, there's no one way to know that. But we have to be vigilant as parents. We have to look for any signs or changes that is happening in our kids' life. We can have some physical changes. We can have some behavioral changes. And we can have some changes like, they change the group of friends they're with. They're becoming a little more lonely. The hygiene is changing. The loss of appetite. Now, I'm not here to diagnose anyone or to say, well, if somebody is having this issue, that means that they're abusing or that they're using. No, that is not what I'm saying. All I'm saying is we have to be vigilant and look out for these signs and changes, because That is what will allow us to catch this early. And the earliest we're able to detect that there's a problem, the better the outcome is going to be. The earliest we talk to our kids about this issue, the better the outcome is going to be. Studies have shown that 90% of people with substance abuse started before the age of 18. 9 out of every 10 people with substance abuse started before the age of 18. But the good news is also that the studies have also shown that 6 out of 10 kids who have been spoken to by their parents about substance abuse are less likely to use. So the education and the conversation that we will have with our kids will definitely have a very, very good impact into the outcome that we're trying to achieve here. Those are some of the basic things that we can do. It doesn't require anything that we're going to buy or anything extraneous to start to give our kids the tools to make those healthy choices for themselves. The other thing that I mentioned last time, and it is important to bring up, we talk about this kid that is maybe 4 years old taking multivitamins and things like that. It could be a kid that is in high school already or in middle school talking about their favorite star, who just overdose on something, and that's a musician or an actor that they like. What do you say? Because that was their role model. Don't shy away from it. That could be an opportunity to start up the conversation and to show that, yes, they can still be your role model, but just because you're a star or just because you're doing well doesn't immune you. You're still vulnerable. And that means that this is something you still have to work on a daily basis. Yes, they were your role model, they were your star, but they made a bad decision. And when they made that bad decision, they did not get the proper help. That could be an opportunity to have a paradigm shift and talk to our youth about the importance of saying something if they see something. Paradigm shift to lift the stigma associated with addiction. Because this was their role model. This was a star. This was the best football player in the school. And this is happening to, this was the best sport person, or you name it. Yet they succumb to this issue. This could be a way to start up that conversation and say, just because you're doing well in school now, just because none of your friends have an issue doesn't mean that you're immune. You still need to continue to work at it. And in the event that something happens or you see something, say something. You're not being a snitch. You are not just talking bad about your friend. You are bringing up something that we can use to help your friend or relative get better. So that paradigm shift, lifting the stigma, is huge into fighting this crisis. Another thing, if you take your child to the doctor and they give them prescription opioids, you need to know how many tablets they're getting, how often they're taking them, and do they really need it after a certain period of time. And if you feel like they don't, you can bring that to the police station and discard of it. Now in Massachusetts, you do have the ability to ask for less than the prescription calls for. So if you bring your child for a root canal and then they're given 15 tablets of Percocet or oxycodone or Vicodin, and you feel like, well, they might only need 5, it's okay to let your pharmacist know, I only need 5. And if they need more, you can always go back to the doctor and get more. But there's no need these days of keeping these medications in the household unless they are being used for legitimate purposes. So taking that ownership into, educating yourself and educating the kids about some basic things that you can do, some basic steps that you can take to safeguard your home is important, and it's only going to help us continue to tackle this epidemic, to tackle this crisis. These were some basic things that I wanted to talk about today, and I'm looking forward to continuing to converse with you on this issue about how we can do this, how we can, believe me, 130 people dying a day from this epidemic, which is one every 11 minutes or so, is something that should keep us all up at night. And we cannot talk enough about it, and these basic steps hopefully will help you safeguard your home and make sure that you keep your kids, your family, and your neighborhood safe. On that, I thank you very much for your attention, and I will talk to you next time so we can continue this conversation. Thank you very much, and have a good one.